So, you got your ACE inhibitors, you got your ARBs, you got your beta blockers, your calcium channel blockers, your diuretics. You got your loop diuretic, thiazide diuretic, and potassium sparing diuretic. You've got your spironolactone, your aldosterone agonist. You got your blood thinners, your alpha agonists, and your cholesterol medications. So, with all that in mind, I know I don't have all that memorized. So some of the ACE inhibitors, those are things like your Vasotec, your Lotensin, your Acupril, right? Your Altase. Those types of things, you know, there's lots of different kinds of side effects. And I think if I just went through all of this, it would be a little bit too much. But I think the thing to look at is that when used with a Advil or an acetaminophen or some sort of like, they call it NSAIDs, like over-the-counter painkiller basically, you want to watch out for fluid retention. If you're taking an ACE inhibitor, your Ramipril or your Prils, you want to make sure that you're not getting extra ankle swelling, or that the skin around your shins is not changing color or looking a little boggy or white. You know, both of those things, your over-the-counter non-steroidal anti-inflammatory, like your Advil or your Celebrex or your Prox and stuff like that, a bit more fluid retention in the body, so keep an eye on that. Both have to go through the kidneys, and so you can take a look and make sure that your doctor or myself are monitoring kidney function. And generally there's a dry cough that can go with ACE inhibitors, which if that is becoming a real issue, then you can talk to your doctor about switching to something else. There's one that's very similar to an ACE inhibitor that doesn't have a dry cough to it. Still, it's a very, very similar medication actually. And those are your ARBs, your angiotensin receptor blockers. And all these different families of medications. Watch out for potassium, okay? So if you're taking an ACE inhibitor or an ARB, just make sure that you heard your doctor say, don't take potassium supplements, okay? Don't take potassium supplements on your own if you're on these medications, right? Just talk to your doctor about potassium if you're worried about that, and make sure that potassium is being monitored. These are some of the things that you can be looking at and going, okay, my doctor's doing a good job. Like, oh, look, like they've already checked my kidneys. They've already checked my potassium. I listened to a video with Dr. Angela and she had me look at that, and look, it's going well. I feel more confident in the care that I'm getting. And wouldn't that be great to look at what's going on, critically analyze the situation, and realize that you're actually being really well taken care of. Beta blockers. Very, very, very common beta blockers are. They will interact with calcium channel blockers as well. So, but our doctors around here are so good at monitoring for that stuff. Like they've got that down pat. But it is something for you to be aware of. Okay. You know, this is your like propranolol and metoprolol, these types of things, the OLOLs. Most common adverse effect, low blood pressure. And I do see low blood pressure a lot when someone starts a beta blocker, okay? Possibly sleep issues, so just keep an eye on sleep. If there's dizziness and fatigue, if there's like circulation problems at the fingers where they're kind of going white or purple, low blood pressure. So, the thing about this one is you want to be careful because there's a group of medications that can interact with cardiovascular medications that we don't talk about, and those are erectile dysfunction medications. Erectile dysfunction medications, Viagra, right? And all the other ones. These have significant interaction potential with cardiovascular medications, and so I want you to be aware of that, okay? And make sure that if you have multiple doctors that you're getting prescriptions from, that each of your doctors knows the other prescriptions that you're taking. Now, what else? You got your calcium channel blockers. My goodness, where does it end? What do you need to know about this one? Grapefruit. You knew grapefruit was going to come up at some point, didn't you? Yes, grapefruit. Grapefruit interacts with calcium channel blockers, and so you want to have to get rid of the grapefruit and the grapefruit juice. But you know, there's a lot of natural health supplements out there that have grapeseed oil, or it's not grapeseed oil. You can have grapeseed oil that have grapefruit seed oil in it. Okay, so if you're taking a natural health product, just watch the ingredient lists. I'm a very big fan of having very simple supplements with people who are taking cardiovascular medications, because there is some interaction potential with herbs, as well as simple things like grapefruit seed or grapefruit essential oil in the diffuser. Yes, there's interaction potential. Yes, if we're putting grapefruit on, there is technically some interaction potential with that. And so just keep an eye out on your supplements and your natural health products. So make sure that if you're taking a calcium channel blocker, especially if you've just started, that you want to take out grapefruit from your life in all its forms. Another common adverse effect with a calcium channel blocker is actually constipation. So just bear that in mind. I think I'm going to stop. That's a big head full of stuff. I'll continue with the medications in the next video.